been so long since I used this camera. I don't even know how it works anymore. Or since I wore makeup. Okay. Hello. Welcome back to Montana. Welcome back to my channel. My name is Larson. It has been a long time since I've been on here. I think the last video I posted was my wedding video, which was a year ago. I got married and it was awesome here in Montana, and then went on a honeymoon to Hawaii. Can't believe that was a year ago. I did make a video of that, just haven't edited it together and put it together yet, but I do plan on doing that. We also went on a 1-year anniversary trip to Oregon, and I got some footage of that, our first time in the Pacific Northwest. So I promise I have still been filming things and have things to come. I've been really busy. I've been in ultrasound tech school this year, so I've been focusing on that a lot. But I wanted to make a video today because I want to talk about mental health stuff. I want to talk about medication. I want to talk about therapy. Mostly medication. I might do another video on therapy, but the whole reason I started my channel back in 2018 was to talk about mental health. I talked about my PTSD, and yeah, that's why I started my channel. So I wanted to kind of circle back on that because, I don't know, it's been 3 or 4 years since I kind of updated you on my mental health. So let's get into it. If you don't know my background, I struggled with depression in high school for different personal reasons, but out of college I became an EMT, emergency medical technician, and I worked on an ambulance from around summer of 2016 to like March, spring of 2018. I was working on an ambulance or volunteering on an ambulance, which was an absolutely incredible job and experience. Go back and look at like my first videos to hear more about that. And feel free to ask questions below here too. If you have questions about that experience, I'm totally willing to talk about it. Long story short, I had to quit that job because of PTSD that started being overwhelming. I just saw so many life-threatening experiences and, you know, saved people's lives and went through a lot that was a lot to process. You don't have a lot of chance to process things during that job, and like other healthcare jobs as well. So I just wanted to talk about that because I feel like it's much more prevalent than the world lets on to, and I know there are people who can relate, especially with COVID that happened and all the healthcare workers who went through that, and I know that was extremely hard. So anyways, I want to talk about how I have helped myself get through that, and I'll start by saying that I didn't run immediately to medication. I, for 2 years, just did therapy and tried to focus on therapy and EMDR, a specific form of therapy for PTSD. But it was around January of 2020 when I realized it just wasn't enough. My symptoms were too overwhelming for me to handle. I remember just being super fragile and emotional all the time. I'd be like driving to work and just hear like a commercial or a sad song or something, and I would cry. I was just super fragile and super emotional, and I felt this like constant anxiety in my body and fear. So I said, you know what, this is too much for me to handle. I've tried for 2 straight years to regulate this, and I think I need more help. So I went and spoke with my primary care doctor, and I explained my symptoms and what I had been through, and they said, yeah, no problem. Let's start you out on an antidepressant and see how that works. I'm sure your primary care, wherever you are, could do that for you as well. You don't need to go to a psychiatrist or psychologist. You can just go to your primary care doctor. So they prescribed me sertraline, which is an antidepressant medication, 50 milligrams, which is the lowest dose I started out on, and I was amazed. Within like the first week, they say it takes 4 to 6 weeks for it to be in your system, which is true, but for me, just that first week, I instantly felt better. I instantly felt like that edge was just taken off, and the anxiety in my body and the fear really subsided. I had a few small like GI side effects, and like headaches kind of, but it was nothing compared to the relief I felt from that anxiety being gone. So it was like the best decision I ever made. I kind of waited till I like cracked and then went in to talk to somebody, but I'm so glad that I did, because it helped me so much. And I was so afraid, even as someone who worked in healthcare and like worked in a primary care office, and I see that people are prescribed that all the time. For myself, it was still scary to go in and ask about that. It still feels like you're not validated for whatever reason. It feels like, oh, I don't really need this, I don't really have this. But if you're struggling, talk about what you're experiencing with a doctor, and they will tell you what they think could help you. So yeah, I went on the antidepressant. I stayed on that dose for quite a while. I believe it was like the end of that year when at my follow-up appointment, I described some of my symptoms, and they thought, oh, you could probably benefit from a higher dosage. So eventually I raised my dose from 50 milligrams. I went to 100 milligrams. I raised it to 150, and now I'm at 200 milligrams. So I slowly increased that over a time period. And that is the dose that works for me. That's what we found worked for my symptoms and relieved how I was feeling. And I've been steady on that for a long time now, a couple of years, and I feel so much better than I did before. I feel like myself again, and I feel, I just feel free, like I'm able to be who I want and not be fearful and anxious and depressed all the time. So I just really want to encourage you to go talk to your doctor if you've been feeling depression, anxiety, stress. Like, don't invalidate yourself. What you're experiencing is real, and these people can help you. That's what they're there for. The same year, I went in to talk to my doctor about ADHD, which I was diagnosed with in college when I was like 21. And I kind of just wrote that one off too, like, oh, I'll be fine, don't really need it. But I realized with my job and what I was doing, I really needed to be focused and be there fully. So I started taking Adderall. Same thing, followed up with my doctor, and ended up on a little bit of a higher dose than I started on, but it has helped me tremendously to be able to stay on track, to get things done, be productive in the day. If you feel like you're just not productive and you can't do it and your motivation is not there, Adderall is probably something that could help you. Talk to your doctor about it. It can't hurt. They'll give you a little assessment. Even Adderall here in Montana, your primary care is someone who could prescribe that. I'm not sure about in the East Coast whether or not you would need to see a psychiatrist or a neurologist. Maybe I had to see a neurologist in North Carolina when I was diagnosed, but definitely talk to your primary care. That's where you start, and they can refer you somewhere else. Then I was working as a medical assistant in a primary care doctor's office. And we would refer people all the time to a psychiatrist in the area when they needed some clarification on their diagnoses and the medication they were taking. And so I thought, the medication is working for me. My problem was, as I upped my Adderall dose, which I felt like I needed to focus, it brought me more anxiety. So I wanted to just see a psychiatrist and make sure that I was on the right medication for the right diagnoses and taking the right amount. So I asked my doctor to refer me over to the psychiatrist, and I was lucky enough to get in there, and she has been amazing. And I just want to say, like, seeing a psychiatrist is not for crazy people, okay? Doctors, lawyers, like big time people, anyone can go see a psychiatrist. It's not embarrassing. It's not belittling. It shouldn't make you feel bad. It should make you feel proud that you're taking control of your mental health and trying to make it right. And that has been an amazing experience going there. It's because it's not just my doctor prescribing and upping my dose and trying to work with me. It's somebody who has gone to school for medication and the mind and mental health problems and knows the reactions in the brain that are going to happen with the different medications and what you need more of and what you need less of and how to balance that all out. So my experience with my psychiatrist has been amazing. She's helped me get on the right doses of Adderall and sertraline, and she's also helped me get on another medication, which is called Abilify. And if you've heard of Abilify, it's typically used for schizophrenia and bipolar. I'm not schizophrenic or bipolar, but my psychiatrist said, you know, we've got the serotonin with your sertraline, we've got the norepinephrine with the Adderall, might be wrong on that one. And then the Abilify, I think is more norepinephrine than I needed. What's the other one? Whatever. There's another one, I think, that the Adderall gives me, another neuroreceptor, whatever they're called. But she said, you know what, this neuroreceptor needs some more. Let's try this Abilify. She says with people who take SSRIs, which is the sertraline is an SSRI, people who take that kind of medication, she's seen the Abilify help when taken at a low dose along with an SSRI like sertraline antidepressant, that it can help magnify the effects and be more beneficial. She said she also has seen a lot of success in patients with OCD and adding a little bit of Abilify. I struggle with OCD, something that I have downplayed my entire life. And this one's hard to explain because this is the one that I already feel invalidated about just because of the experiences I've had. But my OCD compulsions are like the just right feeling things, so I can't really explain exactly what it's like, but I like windows to all be the same. I don't know, it's not like they have to be even or the same, they just have to be just right in my brain, like where the windows are. In my car, I like the windows to be a certain way, and I can't pinpoint to you what that certain way is. It's just like what feels just right in the moment. My other OCD compulsion is I count in my head, I count letters of words that people are speaking, which is really weird. And I can talk more about that, but essentially, like, I said speaking. If I heard someone say the word speaking and I was feeling compulsed, I would count the number of letters in that word. So I know there's 8 letters in that word, because I can just count it that quickly in my head. I've been doing this since I was 8 years old. But speak is 5, ing is 3. I know that's 8 letters. And then 8 letters, EIGHT, has 5 letters. 5 letters, 5, the word 5 has 4 letters, FIVE. And so then 4, the letter 4 has 4 letters, and that's as far as you can go. So I'm doing this in my brain almost every day, and it's just something that I do. It's an anxiety that, it's an anxiety coping mechanism essentially that I created when I was really young, when I was going through trauma, and yeah, it's something that I've kept up. So that being said, I have had a lot of relief, found a lot of relief with adding the Abilify, a really low dose. So normally people would take a higher dose for schizophrenia, bipolar, but for working with SSRIs and OCD, I take a half of a 5 milligram. So I take 2.5 milligrams of it just to augment what I'm already taking. And I've found good success with that. It's been about 2 months that I've been on that, the regimen of those 3 medications together, sertraline, Adderall, and Abilify. And I would say that my OCD compulsions have gone down. It's not that they're not there, but I'm able to better prioritize in my brain what I need to be doing instead of what I'm compulsed to be doing. And so that's awesome. And she was right. Like, it is working with me and OCD. And I want to say that Abilify is not the first medication I tried for this. I tried a different medication, which I had bad side effects too that I did not like. And so she said, you know what, we wanted to try it, but this isn't right for you. Let's try something else. So don't be afraid to try the different medications. You have to go through a month or so of trying it. It takes time, but you need to be able to assess yourself and see what's working for you and what's not. So I was able to tell after about a month that that medication made me feel irritable and just not good, made me feel more emotional. It was helping my OCD, but it was making me feel worse mentally in other ways. So we went over to the Abilify, and I found that I don't have those effects. I just am able to deal with my OCD better. So yeah, so this is my TED Talk to encourage you to go to your primary care doctor. And if you think you have depression, if you think you have anxiety, if you think you have PTSD, if you think you have ADHD, if you think you have OCD, if you think you have anything, talk to somebody. Start with your primary care doctor. Talk to whoever it's easiest to talk to. Your therapist maybe could refer you to a primary care doctor. Look online. Just talk to somebody. Start by talking to somebody, and they're going to get you the help that you need. And if they don't, move on and find somebody else who will get you the help you need, because there are good people out there who care and want to see you successful and happy. And compared to 4 years ago, I am a different person. I changed a lot through that experience, and dealing with PTSD heavily. It was so hard, and I tried to deal with it on my own for so long, and I'm proud of myself, and I'm proud of the therapy work I'm still doing, but I needed something else to help me too, and that was medication. And I'm so happy that I've gotten on the medication that I'm on, and that I found this steady place to be. I'm so happy I saw a psychiatrist and talked to my doctor, and I'm just feeling like myself again, and it's awesome. And I'm able to go to school and focus and study and deal with my mental health and everything else in my life going on as well. So I just want you to feel valid in the way you feel. Don't just sit around and suffer. Talk to somebody about it, and you can feel better, I promise. Okay, I guess that's my speech. But other than that, I hope to be back soon. A couple updates on life. I told you I'm in ultrasound school, so I'd like to make a video about that. I actually did take some footage when I was at my first week of orientation there, and I meant to make an update during my second semester. I'm in my second semester. I meant to do an update before that one and then before my third, so I could see how I've improved, but I might do something about that. I've also got a puppy. I just got a puppy 2 months ago. His name is Rudy. You've probably seen him on my Instagram. If not, go to my Instagram, Spectacular, to see videos and pictures of Rudy. He's the cutest freaking puppy in the world, little mutt. And we got him DNA tested, so I can tell you what kind of dog he is. So stay tuned for that. Definitely going to be making some videos of him because I have so much footage. And yeah, I hope to be back here soon. I have a break from school in about a week or two, so I hope to make some videos and bring you around Montana. It's 96 degrees today in Montana. It is so hot. It's summer, baby. I also would like to make a video on the different seasons of Montana, like winter, spring. Spring is an interesting one here. Summer and fall. I think people will probably be interested in what our seasons are like. So please comment down below what kind of videos you'd like to see from me. If you like the mental health stuff, if you want to hear about Montana, you want to see the puppy, you want to see the adventure stuff, let me know. If you want to hear EMT stories, I'll tell them. So comment down below. Make sure to like this video if you liked it. And if you go talk to your primary care, leave me a little note, say, yeah, you did it. I encouraged you. And if you're not subscribed, please subscribe. I would really, really appreciate that. I think I'm almost to 1,000 subscribers, which is amazing. And I think at 1,000, I can put ads on my videos and maybe make a little moolah. So like, subscribe, and I will see you next time. Thanks for watching.